Let's get this party started. Good morning and happy Labor Day, Great Falls. It's fitting that we are assembled here today, looking forward at we hope is a final stretch of a decades-long fight to win the basic right of health care for people in this country. And I think it's also fitting that we remember who and how we got here today. Ted Kennedy called health care the cause of his life, and it was. Yet in many ways, the biggest cause of his life was public service. It was activism itself, his belief in the power of the people working together to make lasting and positive change, and to use their government to achieve things they could not achieve on their own. Because of his commitment to build a healthcare system that would provide the best access and care to all, Kennedy chipped away for years to make consistent improvements in the healthcare system, even when there was much less hope of comprehensive healthcare reform that we have now. Our country's history and the personal history of millions of families are marked by his success. In 1966, Kennedy helped establish the Community Health Center model. That Community Health Center model now serves 20 million low-income members around this country. In 1985, Kennedy led the fight to enact COBRA, giving workers the ability to purchase health care through their employer after they had been let go from their job. In 1996, Kennedy co-sponsored HIPPAA, which now ensures access to health care coverage for an estimated 25 million Americans who move from one job to another, are self-employed, or who have pre-existing medical conditions. In '77, Kennedy was instrumental in passing the CHIP program that gives health care to millions of our children. In 2006, Kennedy passed the Family Opportunity Act. And from 1997 to 2008, Kennedy helped grant Massachusetts Medicaid waivers it needed to help pass its state's health care reform plan. As amazing as all of this work is, the fight is far from over. The fight is not over for Ezekiel, a young boy from Wolf Point that's covered by IHS. Ezekiel is 13 years old, and he has a black spot on his lung that's grown over time. But he can't see a specialist because he's not dying. He's not dying yet. He's at level 12 funding, which means patients can only see a specialist if they are at risk of losing their life or their limb. In the meantime, he's been diagnosed with pneumonia, and the spot continues to grow. His mother is sick, worrying about her son. The fight's not over for April, a Missoula student who was diagnosed with epilepsy when she was 18. She's now 22, and April doesn't have health insurance and pays all of her out-of-pocket expenses. She was covered under her parents' plan prior to her diagnosis, but they won't cover her parents since the diagnosis. Prior to that, the family plan was $400 to $500 a month. After the diagnosis, it went up to $800 a month and covered only 10% of her costs. Just this morning, I was watching Hotel TV, which many of you who know me know that's what I like to do in the morning. And I heard another incredibly heartbreaking story. The story of a father who was a computer programmer who lost his job last year. And when he lost that job, he lost his health insurance. Unable to find a job with health care, he made the decision to re-enlist in the armed services. His last tour was 11 years ago. His 3-year-old son, Jack, has health insurance, but he no longer has his dad. His father was killed within 1 month of being deployed in Afghanistan. The fight is not over for Jack. And while Ted Kennedy may no longer be with us, it is up to us to pick up the fight. When it comes to health care, Kennedy's entire life was helping to create the extraordinary and historic opportunity we have in front of us today. to finally realize his dream of healthcare for all. Not in bits and pieces, not for some, not for others. There is simply no greater way to pay tribute to his life and to honor his legacy than to fight for quality, affordable health care and insist that we win it this time. Settling for anything less was the last thing he'd want us to do. When he defied his own illness to speak in Denver to support Barack Obama, he did so in part to break the old gridlock and guarantee that every American will have decent, quality health care as a fundamental right and not as a privilege. And as he made clear in his essay in Newsweek less than 1 month ago, incremental measures will not suffice. The conditions now are better than ever. We are almost there. And so I ask all of you today, if Ted Kennedy could carry on this fight for 47 years, I know we're tired. We feel like this has been going on a long time. But do we have enough fight in us to carry it on and make sure that healthcare for all is a reality? Well, we're gonna do it!